Have you ever wondered why some people thrive on medication while others struggle to find the right balance? Well, in this compelling segment of the discussion with Carly Taylor, we tackle the often misunderstood world of emotional health and recovery. Carly brings her expertise, right, to the table. Because we explored the complex relationship between ADHD, medication, and some holistic health approaches. Whether you're dealing with mental health challenges or supporting someone who is, this conversation offers valuable insights about creating sustainable well-being. Here's Carly for part 4. Make sure you tune and go back to part 1, 2 and 3. Part 5 comes tomorrow. Here with Carly Taylor. Enjoy, and don't forget to subscribe to the channel. Always helps. Did you ever enter any other not darkness, but tough times with all this knowledge now? And I think that would be, you guys would be better prepared, but you're still human. Have you gone down a darker space since having all this knowledge and this journey that you and Paul have been on?
Yeah, we did. Just a couple of years ago, my son, who's now 14, he was 11 turning 12 back then. So everything was going great with him. He was in year 6 and he was the school captain and captain of his soccer team, doing really well at soccer, like super strong, athletic. But what we noticed was happening kind of mid-year is that he stopped growing. Like his friends, he was always one of the tallest in the class, and they just stopped growing. And we thought, this is really weird. But then he was growing hair everywhere, and we were kind of like, what is happening? You're thinking maybe it's something to do with puberty, but Paul was researching and going, this is really strange, because normally you have a growth spurt and then you start growing the hair and shaving and all that. But he was shaving it at 12. It was really, really strange. And then he started putting on weight. And his confidence went down, stress levels went up, and we just did not know what the hell was going on. Eventually took him to the GP, probably could have taken him earlier, but eventually took him, and the GP was like, it's probably just some sort of developmental thing, but I'll send you to a paediatrician, just get him checked out and he should be fine. And so by the time we got into the paediatrician, Oscar had put on so much weight. We had before and after photos, and his face had ballooned out. So he had like this moon face and this double chin. And we're talking an athletic kid, exercising every day, eating really healthy food, hardly ate ultra-processed food.
What was the period of time from that point to this point?
So we started noticing it, it's 2022, around June, July. We started noticing these changes, and then this was then December.
Yeah. And the changes would have already been before you noticed it as well.
Yeah, definitely. And I thought he was I noticed he was filling out, but I thought he was just growing up. He was just at that age.
But he's eating well, not ultra-processed foods.
Yep. And exercising every day, really sporty, soccer, tennis, was just running around, just a normal, active 12-year-old kid. But this weight gain was happening. So we went to the paediatrician. Now, Paul knows, he's a stress expert. He knows a lot about stress hormones. And Oscar was really stressed in year 6. We thought he took his role as school captain very seriously, and he was having his relationship with the year 6 teacher, which I won't go into, that she had all the best intentions, but it was stressing him.
Yeah.
And Paul said this must be cortisol. Because what happens when you get stressed, your cortisol levels rise. Cortisol's normal to rise in the morning, and then it kind of tapers off at night. But when you're chronic stress, it rises and it stays high. And then that can cause this moon face. And I'm thinking, that cannot be right. We cannot have a 12-year-old who's so stressed he's having a physiological effect. Yeah. So we took him to the paediatrician, and we were, of course, on Dr. Google at this stage, and looking at what it could be. Went to the paediatrician, and he wanted to watch and wait. And Paul just said, I want his cortisol tested. And he said, Paul said, there's 2 ways you're getting me out of this office. You can test his cortisol, or you can call the police.
Wow, I love it.
That's how adamant he was. And so they tested his cortisol.
Of course.
and it was high. It was 15 times higher than normal. So he was raced into Monash Children's Hospital. And
day?
we were there. No, it was, this is just before Christmas. It was a couple of weeks, but
Right.
even then I thought that was quick.
Yeah.
And he went through, we were there for 4 days, 3 nights, and he was just tested, all these tests. Anyway, he was diagnosed with what's called Cushing's disease. Cushing's disease is a tumour on the pituitary gland, and it's a functional tumour. So what it does is it secretes ATCH, which then tells the adrenals to pump out cortisol. But what constantly. So there's another hormone to tell the adrenals to stop pumping out cortisol, but that had shut down because the pituitary gland just completely shut down when I'm going to sleep. This tumour's taken over. It's fine.
Yeah.
So all these pathways were affected. So my 12-year-old had high cortisol, 15 times higher than normal. What happens is you get weight gain, you get the moon face, you get acne, you get hair. Everywhere he had hair on his back. He was shaving, and his mental health just spiraled down. He knew when he was diagnosed. Of course, he was getting on and finding out himself what it was, and because he knew that his growth had stopped as well. In his mind, he's like, well, I'm not growing, but I'm getting fat, so I need to watch what I eat. So he became obsessed with food. The rumination about food was, if anybody has suffered with rumination chronically, it is like torture. And he couldn't think about anything else but food. He couldn't be around his friends because he would analyse what they were eating.
Yeah.
He was in the kitchen. My kitchen was clean all the time. He suddenly got OCD about cleanliness, and this is never before had he been like this. And
he was already eating well.
He was already eating well, so now he became obsessed with exercise as well. So he was calorie counting, exercise obsessively. So that was hard for us to watch.
Yeah. So
not only do we know at this point that he's got a tumour, he needs to have surgery. He was booked in for March, so we had about 3 months to wait. But in the meantime, his mental health was spiralling down, where he actually said to me, "Mum, everything's grey." He said, "I just want to be a kid again." So Paul and I, we had to, I guess, really get clear on what we could control, which is part of the work we do and part of something that I would work with a client straight away. It's like, what's within your control and what's not within your control.
Yeah.
And then put all our focus on, okay, what can we control here? And that's what Oscar was doing. He was putting all his focus on, well, I can't control that I'm not growing, but I can control what I eat and how much exercise I do. So we had to keep an eye on that. We didn't stop him completely. We had to manage it. We had to rein him in when we needed to. But while he was on this journey, this is what he was doing to keep himself going. He's probably the only person with Cushing's disease that's actually lost weight, because it's very, very unusual.
Right. And he lost the weight because of what he was trying to do.
Yeah.
Wow.
Yeah, but he still had the moon face. So we had to really get clear on what our roles were. Paul he cut down on his work. He and Oscar spent an incredible amount of time together, as I did as well. We went for a lot of walks, and that, looking back, because now he doesn't like going for walks with me, but
walked out.
Those walks were just such special memories for me, because he would open up to me. We had amazing chats, and I guess it was a silver lining of a bad situation.
Yeah.
So the acceptance of the emotion. So, we didn't know what the uncertainty of the surgery. of course, your mind comes up with what if they don't get the tumour? What if there was a risk of blindness, paralysis, and of course death as well, because they needed a neurosurgeon and a ear, nose and throat surgeon to do this job. And it actually, just to rewind that, it actually took a while to find the tumour. They didn't know where it was. So it was like an episode of House, if you've ever seen House.
Yeah, well, a long time ago, yeah. I'm watching The Resident now. It's probably relating to that. Have you seen The Resident? I feel like I'm...
And it's like a detective work. It was like, we need to find this tumour and go through. And some of the tests that they were going to do were very invasive. Some of our endocrinologist had never, this is how rare this disease is our endocrinologist, who was very senior, had never had a child, pediatric endocrinologist, never had a child with Cushing's disease. So she was pretty green on the processes. So if we look at what can you control, Paul just went head on into research. And he would hand her the research papers and go, we need to do this MRI protocol, we need to do this and stuff. And she was very open to that. And the team were open to that. Yeah, I think towards the end she was a bit over Paul telling her what to do. But you do, Ed, you do what you if you want to save your child, you will do what you got to do. And confidence, you think with trust, you want to know that they're competent. It's like, if you don't think that your medical team are competent, then you're going to do everything you can to get them up there.
Yeah.
So
how rare?
So 1 in 5 million kids get it.
1 in 5 million. Oh my Lord.
Yeah. So
and it's not normally in children. It's normally in adults, is it? Because you said
normally
it was...
in adults.
Yeah,
very common in horses and dogs.
Oh.
More common in adults. Not common though. But very rare in children. Yeah.
Wow. What a poor. And do we know a root of why and how?
No.
Just completely random, or?
Look, I believe there's always a reason for everything, but we don't know. We just don't know.
But I think we've got to mention here, the importance of here is you guys having the knowledge that you do, even though Paul and yourself probably weren't experts in that area because of how rare it was, just the background that you guys have got understood to go deep. And I think we need to send that message to everybody who's listening is, don't just always, and I'm not saying we don't rely on doctors because they do some incredible work, but they're so overwhelmed. I've got a friend who's a doctor, and he shows me his phone. He has 500-600 messages he's not read. He has tens of thousands of emails. He's so committed to the cause, to his GP, his building, his patients, and he works hours writing notes upon hours. When does he have time for professional development? Right? When does he have time to extend his knowledge? And that's not putting it down. It's the system I think we need to look at. So I think my message out to everybody is rely on the doctor, but don't just solely rely on them. Go and do what Paul and yourself did. Go and look a little bit deeper. Look at the literature and see what else it could possibly be. Just start to be, as opposed to going choice and awareness, isn't it?
Yeah.
To go a little bit, dig a little deeper because we can get answers. Be
involved in the process and question.
Yeah.
Because you just have to. And the other thing, I think looking back, I remember there was a time I went into my room and I just burst into tears.
Yeah.
And I just felt this heaviness and this emotion, raw emotion. And I remember Paul coming in and he started saying, we need to hold on to hope. We've got to hold on to hope. It's okay. And he's right, you do. And I said, just let me express this. So I knew that it was just what I needed to do, but it didn't take me down a spiral though. And every time I felt that, I would draw myself back up. And looking at the stuff that we do and talking about fundamentals, it's like if you are going through a challenging time, you have to keep those fundamentals going. Exercise, sleep, nutrition, mindset. It's like I went for a run every day in the morning. I stopped drinking alcohol completely because I knew that was not going to be good for my sleep and my nervous system. Prioritize sleep. And because if you don't do that, that's going to affect your ability to cope.
Yeah, agree.
So, yeah.
So just to tie that up, then I'm sure the viewers want to know, how is your son now then?
He's good. The surgery took 4 hours and it was a success. They got rid of the tumour, and it was a long road of recovery. His cortisol was so high, and then when the tumor came out, it literally plummeted. It didn't go to zero, which it does for a lot of people, but it was very low, so he had to be on hydrocortisone. And then that had side effects, just muscle weakness, energy levels, all that sort of stuff. But so his 2 years, March the 8th was the surgery. So he had just had his 2-year anniversary. He's back playing soccer. He's not the athlete he was, but that's okay. He's in a really good place. He's got a really good group of friends. He's growing. He's still on. We've kept him on growth hormone because his growth hormone had stopped. Right. So just in this developmental, this growth period that he's in now, we've kept that going. But he's really good.
So if you took the growth hormone out of him, would he still stop?
It would take around 6 months to know whether his natural growth hormone would kick in, and we just don't, because he's 14 and this is his growth period. We just don't want to risk that.
And that's where we can benefit from the wonderful science that we do have, right?
Yeah, absolutely.
Yeah,
we're so lucky that we have all this science and these pharmaceuticals and everything that keep us alive.
Because that treatment there isn't covering up a problem. It's like all the other things that we've discussed, and I suppose that's maybe a good direction to go on before we come to an end. What do you think we are? I don't even know how to ask this question, but what have we lost the art of connection? Have we lost the connecting to the earth? Have we lost the connection to relationships or actually, no, let's scrap that. Me and Paul did discuss medication briefly, and I know it's an area that, but what's your feelings on medication for things that we just medicate daily for now?
Yeah, I feel that, if you look at SSRIs, anti-anxiety medication, no doubt it's helping a lot of people, but we are living in a time where we're pathologizing normal human emotions.
Yeah.
And what really concerns me is that our young people are responding to a tough circumstance like a relationship breakup, or maybe they didn't get into the uni they want, or just normal stuff that creates an emotion, and they automatically think something's wrong with them and they've got to pop a pill to fix it.
Yeah.
That really concerns me, because life is a land we are going to experience this landscape of emotions. It's inevitable. It will happen. And I think we need these skills to be able to live our lives and experience this roller coaster, because the option is going on medication, which has its own side effects, which doesn't always work, and I don't feel like it's teaching us anything. The other thing I feel with some of the medication, that even the advice is not to just take the medication alone, but to have coaching. Like ADHD medication, it should be done in conjunction with ADHD coaching, or if you are going through a tough time, going and seeing a psychologist or a therapist in conjunction with the medication. The medication alone will not work for you long term.
Yeah, because me being in schools, I see a lot of children going to the office reception area for ADHD treatment, medication, Ritalin, for example. And I don't know if they're having coaching or not. I assume they're not, because there's that many. I don't know, what is Ritalin the right answer? What effects on the neural pathways does Ritalin have? Do you know at all?
Look, I don't know, Paul. This would be Paul would have a more of an answer to this, but I do know it's like taking speed.
Yeah, so, it's an amphetamine for adults. Adults use it as an amphetamine. Yeah, well, it is an amphetamine, but they use it for pleasure.
Yeah, that's right. Yeah.
Yeah.
But if you and I took Ritalin, we would be super focused, like hyper focused. Anybody that takes it is going to be hyper focused on it.
Are they retaining information though?
I don't know. I don't know that. I think so. Yeah, okay. I think. I mean, look, we've got a friend whose son, I think he's around 10, who was. You would know he's got ADHD. He was really struggling with anger issues, like couldn't sit still, just like, little ball of this, probably some cartoon that would reflect what he was like. And then so they've medicated him, and it has completely changed his life for the better. So there are cases where it's been a godsend, but I do think we're overprescribing. And that's really, really concerning.
Yeah, I worry about the foods that these children are eating in the mornings.
Yeah.
You know, there's, you know, even these healthy looking cereals that are at the bottom of the pile in the supermarkets. You know, I've done some reading and asked some experts on things like, I think I mentioned to you in our pre-chat, but there's certain genes that can't convert things that are sprayed on our foods, like folic acid seems to be a problem with some children who can't convert it. My son has the MTHFR gene. I think he has the weaker variant, and I think there's 2 variants, but one being weaker. And then obviously there's a percentage whether it's come from 1 or 2 parents. And, you know, I see that every day they're eating these breads and they're eating these, well, then sugar. Don't even get me started on sugar. But they're eating these other things that they just don't know is unhealthy. We just assume it's healthy because it comes in a nice fancy box and it whatever.
Has the heart tick of approval.
yeah, absolutely.
Which is very misleading.
Yeah. And I think, again, if we just understand our body at a cellular level, we can give the roadmap to our children to go, right, well, here's the roadmap for you for the rest of your life. You can change the expressions of your genes if you know what to put into your body and what you can leave out, and if you do, then you understand the risks that you're taking, right? They're making an informed decision themselves as they get older. Obviously I can control it right now, but I think just something simple as taking the folic acid out of my son's diet has changed his what would have been racing mind, and it's calmed him down.
That's amazing. But, you know, and your son's so lucky that you went to that level, but because most people just go into their GPs, and their GPs aren't trained to look into that level.
Well, my friend the doctor, we said, look, we want a methylation test, we want an MTHFR. It was $60. We couldn't really afford to go and spend $500 on the full generic gene test. We will, and I've got my daughter, and we want to do it to her probably before puberty. I want to get that done, but and then they've got a roadmap to, you know, if something bad happens, are they more prone to go down the anxiety route? Even this will give them that type of result, right? And then they can be ready for that, and they can look at after themselves at a higher or deeper level. But, you know, even the doctor, bless him, he said, yep, we went through the MTHFR, and I said, well, that's a problem with methylating B vitamins and things like folic acid. And he said to me, look, I didn't know that. I'm gonna have to look into that.
Yeah.
But he knows what he's doing, and he doesn't. This is no disrespect to him. He's brilliant. He's a very good friend of mine now. And but he just didn't know. Again, going back to all the text messages and emails and the time that exists on the planet that he doesn't have to go and develop himself further. But because I brought that to his attention, because I do have the space and time. Well, I don't, but I did. You know, I think it's fascinating if we can incorporate that into the education system, the government, and filter it down. Maybe children who don't need to be on Ritalin don't need to be on Ritalin. We can look at the cellular level stuff and put what we need into their bodies better. And there might be some children who benefit from Ritalin, at least they're benefiting from it. But I think there's a large proportion, based on what you said before, where we're overdiagnosing. Maybe a lot of these children don't need to be on it. And like you said before, the side effects to all of these things, we're fixing one problem but creating 10 others. I don't know the answer to that question. And I'm probably not willing to go down that route because I don't want to get shouted at.
I must say, just but with Oscar in his recovery, that he had a lot of deficiencies just because his body had taken such a toll on his body. So we went to an integrative doctor. So if anybody is concerned about their child having ADHD and they perhaps want to go into a different level, go and see an integrative doctor.
I'm going to write that down.
Yeah, because they will do, and best to go to someone who maybe specialises with children, but they will do the blood tests and all these gene testing that your GP isn't trained in. This is what they're trained in. Yeah. You do have to pay a bit more for it, but it's worth it. Because my daughter, my 19-year-old daughter, and Paul have a gene where they are susceptible to obesity and diabetes.
Join us tomorrow to hear more from today's incredible guests and learn valuable insights to help you lead your own way. Don't forget to subscribe. We'll see you then.